This video is a update of a video that I posted back in April of 2012, about a year after my Bell's palsy had been diagnosed in February of 2011. So after I had the Bell's palsy, I developed a nerve disorder, nerve damage called synkinesis, which synkinesis is basically a misfiring between the brain and the muscles of the face. On this is my affected side, my left side, and the nerve that was damaged is back behind here in your ear, behind your ear, the seventh nerve or something like that. So don't quote me on that, but that's what I think. And anyway, these are the symptoms that that you tend to have if you have synkinesis. You have a lot of asymmetry in your face because your affected side doesn't move the way it's supposed to because of the misfiring between the brain and the muscles. So when I close my eye, my left eye, or even just when it blinks, the corner of my mouth goes up into a sort of a smile position. So I'll demonstrate that for you. So that is an involuntary motion. I'm not trying to do that. Why would anybody try to do that? But that's probably the biggest symptom of it. People think you're winking at them all the time, and you're not. So it's actually kind of funny. But anyway, so as you can see, when I blink my right eye, nothing happens to my mouth. So that's the way it's supposed to be. So that's one of the main things. And another thing is this ropey muscle that comes right down here from your chin down. And there's also a dimple that forms right here. When I do smile, there's a dimple that's right here. And also, as you can see, this muscle right here is very prominent, and on this side it's absent, so it's not supposed to stick out like that whenever you smile. That's a anomalous thing for it to be doing. So that is another symptom. Another symptom that's kind of bothersome. It's not really anything anybody would really notice or anything, but it's kind of bothersome, especially when you're eating out somewhere, is that your eye, or my eye, this eye, tears up when I eat. And I've heard it called the crocodile tears. I don't know if that's the original where crocodile tears came from, but that's kind of what it's called. That's what I've heard that it's called. So your eye will just tear, and so I have to use a lot of napkins and Kleenex to wipe my eye while I'm eating. And also that fluid goes into your nose as well, and I'll end up having to blow my nose, excuse myself from the table, and go and blow my nose because I need to do that periodically while I'm eating. So that is bothersome when you're out in public eating. So those are basically the main issues with synkinesis. And the asymmetry, obviously, when I smile, as you can see on the non-affected side, it's just a regular smile, and then on the affected side, it's sort of a half smile, and my eye kind of narrows and closes There's also some more subtle things that you can't really see on this video that are right in this area right here that happen whenever you do like that. It's not symmetrical. It doesn't move the same way, and that's mainly the thing is the asymmetry of your face. So one of the things that help it is botox therapy. So I'm going to go and check that out and see what the doctor has to say about that, see if it's a promising thing for me to do at this point, after it's been going on 2 years since I've had the Bell's palsy diagnosis, and things are not resolving themselves even after facial exercises and facial retraining therapy and all of that. It's just not getting that much better. So I'd like to have some more symmetry in my face. So I've heard some really great things about it, that they've had some great success with it, and Botox only lasts for 3 months, but from what I've heard, the effects can last even after the Botox wears off, because these muscles that are tightening in the left in the affected side of your face have a chance to relax and maybe relearn what they're supposed to do again, because I do get muscle spasms right in here a lot of the times that are kind of it's annoying. It's nothing that's noticeable, but it's annoying and a little bit of a nuisance. It feels like a cramp in your toe, only it's right here on my face. So so we're going to see if that's promising for me, and so I really hope it is. So we can see how much improvement I can get. So I wanted to make this video to compare to the last video to see, really how much progress I've made in the 1.5 years since I've first posted that other video to now. And then I'll post another video after the procedure is done, if I decide to have the procedure or whatever, to see exactly the progression from point A to point C. So, so that's the plan. So until then, I'll see you later.